first of all, what we investigated is fibrinogen depletion, which can happen after thrombolysis, and thrombolysis is a mainstay of treatment for ischemic stroke. And after you give thrombolysis, so you give Alteplase, a drug, IV, so intravenously, it may happen that Alteplase can decrease the fibrinogen. Okay, fibrinogen is one of the most important factors for coagulation. So the action of Alteplase, so the action of thrombolysis, can actually decrease fibrinogen. When this happens too much, it may expose patients to a higher risk of bleeding. So our main hypothesis was that when this happens in a non-normal, in a non-physiological way, it may increase the risk of bleeding in these patients. So you are actually treating a patient with a clot, giving thrombolysis, and you expose him to the risk of bleeding. So what we did is a multicenter longitudinal study to address this particular feature. And we tried to investigate if fibrinogen depletion, so a drop in fibrinogen levels after thrombolysis, can increase significantly the risk of intracerebral hemorrhage. So what we did is we investigated these across 6 sites in Italy and for overall more than 1,000 patients. And what we saw is that actually a fibrinogen depletion can happen already after 2 hours from thrombolysis. It's something that happens very early along the process and can expose the patients to a 4 times higher risk of bleeding. So this is very, very important because it's a factor which is modifiable. Contrarily to all other factors that increase the risk of bleeding, which are absolutely non-modifiable, such as age or the stroke severity at admission, this particular factor is modifiable. So you can give fibrinogen IV, so what is called fibrinogen repletion, to reduce this drop in fibrinogen. And this may be, let's say, a therapeutic advance in the field of stroke. Let's say it can critically limit the rate of intracerebral hemorrhage. This might be a game-changing thing. So the first thing that we can take away and we can directly apply into daily clinical practice is that we should monitor fibrinogen levels, and we should monitor them already after 2 hours from thrombolysis. If we see that the fibrinogen is dropping, so we may think of fibrinogen repletion to avoid the risk of bleeding, to reduce and cut off the risk of bleeding. And the second message is that we should probably do a randomized controlled trial with fibrinogen repletion. And this is already, it's a trial which is soon to start, at least in Italy, in 2 centers. And it's a pilot study. So we think that maybe we can have some more results to propose this as a therapeutic strategy.